Hi, I'm Fliss.
I'm Sophie.
We're Associate Directors as part of Addaction.
Addaction is a national voluntary sector organisation that provides substance misuse and mental health services in communities all the way from Cornwall up to Dundee. We work with children, adults and young people to help them make positive behavioural changes in their lives, and we also provide specialist support services to targeted groups such as veterans, the over 50s and families. Last year was Addaction's 50th anniversary, and today we work with 130,000 people per year. The rates of drug-related deaths are now at the highest since records began, and the UK accounts for 31% of drug-related deaths in Europe. We think this is a national disgrace, and we think more should be done at a national level to address this. One of the changes we'd like to see is the provision of naloxone. We've seen firsthand with our staff and service users the impact this can make on service users' lives and how it can actually save their lives. So for us it's a no-brainer that it should be provided to groups that are at higher risk of overdose, such as prison leavers. Another area where we'd like to see change is with regards to safer injecting. So we know that needle exchanges can help reduce the risk of bloodborne virus transmission, and yet in a survey we did last year, 50% of service users who were using psychoactive substances or injecting psychoactive substances told us that they feel the support just isn't adequate. So nationally, we think we need to empower communities, individuals and services to work together to bring about change and reduce the rates of drug-related deaths.
It's been really great to speak to a range of people today who recognise drug and alcohol as a priority public health issue. There's been probably three main conversation topics that we've been having today. The first one is around older people, specifically older drinkers, and we've been sharing our experiences from our Drink Wise Age Well programme around the campaigning, breaking the stigma and the services that we've been providing to over 50s. The second area is around early intervention and prevention. And again, we've been sharing our experiences around adverse childhood experience and trauma and the work that programmes such as Mind and Body are delivering. And the third thing is we hope people have come away with is a realisation that it's actually the communities that when they come together, that's what sustains recovery and the changes that we're able to support as a service by sharing our experiences of Green Slate Farm in Wigan and the Kilmarnock railway station. I've just mentioned a few, but to expand on one, I'll choose Mind and Body, which is a programme that we're delivering in Kent, Cornwall and Lancashire, which works with young people in schools who are either self-harming or are vulnerable to self-harm. We've seen some amazing results through the project. We've worked with young people who haven't previously engaged or spoke to anyone about their self-harm, that wouldn't meet the CAMHS threshold for support, and we know through the evaluations that 91% of young people, while they're working with the programme, stop their self-harm actions. There's other great statistics and detail about that and our other projects that you can find on the Addaction website under research. I found the morning speakers really inspiring, particularly Dr. Martin Reeve and Michael Marmot talking about tackling health inequalities. And it's been really great to hear how that needs to happen in communities and be action from the ground up and involve everybody, which is core to our values.